This patient has ongoing back pain. Today we're going to look at two tests to determine how well she can stand up without using her low back. The first one that we're going to use is called the Ober's test. What I'm going to do here is I'm going to lift up her leg slightly and then slowly drag back the leg into hip extension, looking at how quickly she arches her low back to do this behavior. And for her on the right side, it happens right around 45 degrees. You can see that hip starting to go forward relative to my hand, and she's getting some low back tone. The other test that we'll use, she'll transition to her back. It's called an active straight leg raise test. She's going to make sure that this knee is fully locked out, slowly raising it up until she feels some discomfort in the front of her hip. She gets a line of pain right here in the front of the hip, which indicates that she lacks femoral mobility or hip mobility to demonstrate a stance without using her low back. So now we're looking at the left side of this patient's body and her ability to extend the hip without using the low back. I'm going to slowly pick it up, dragging it slowly back and looking for not only the back to extend, but the rib cage to go forward. And right there you see the right leg starts to drag back with the left leg, indicating that the test is over. But on the left side, we have about 70 degrees of extension, whereas on the right, we had about 45. This will correlate with our straight leg raise test as she goes on her back. We had 30 degrees on the right, and on the left, she's going to keep this knee locked out, slowly raising it up. And you can see right about there, she starts to get this line of discomfort. The quadriceps starts to tighten up, and she's trying to move more so past the mobility that she has. But again, this is higher than the right. Therefore, we're going to try to push her from left to right using an arch support. So due to the fact that her right-sided tests were worse than her left, we're going to put this insert into her left to help clean up her right-sided stance, therefore allowing her right-sided hip function to improve. Therefore, throughout the day, she won't continually stress the low back and continue with the low back pain that she currently has. Really simple. All I do is place it on the inside part of the left sole, press it in there, and then place it back into the shoe. And this is really easy to do at home, as all she's going to do now is take 25 to 50 yards of walking in the shoe, and then we'll retest. Let's see what happens.
Doing great. Yes.
Direct eye contact.
Yes. 100%.
So now we're retesting the two tests that we used to assess the function of the hip. We're going to start with the left side, which was better than the right side previously, but this still should be improved. I'm going to slowly pick up the leg and then slowly bringing back. We were at roughly 70 degrees prior. You can see that it's a pretty clean test until right about there she had a little drag back of the right-sided leg. But as you can see, this is almost a straight line from her knee to her ear. So this test is improved. If she transitions to her back, this test should also be improved. So she keeps this leg actively locked out, slowly lifting up, and let us know when you get the discomfort. Right there. So this is improved about 20 degrees. So it's a win-win. So now we're on the affected side, the right side. We had 45 degrees on the Ober's test and 30 degrees on the active straight leg raise. I'll slowly drag this back, and we'll wait until we see extension in the low back, flaring of the ribs, or pulling back of the right leg. Right about there, we saw a little budging of the left-sided leg, meaning the test is over, but this is markedly improved from before. She'll then transition to her back, keeping the right knee locked out, slowly raising up. Let us know when you feel the discomfort.
We got there.
Good, so we got to right around 45 degrees, but again, an improvement. So that means she's able to stand more so using her hips as opposed to extending her low back. The first drill we're going to do to help her push off the left side, much like the left arch support does, is a left glute max drill. So she's going to have about 60 degrees of bend in her hip and about 60-degree bend in her knee. She's going to lightly press both feet into the wall without actively trying, and that's very important. Never feeling a strain, never feeling contractions anywhere throughout the body. She's lightly pressing the feet into the wall. Then she's going to gently roll this hip forward and then gain a little bit of contraction in the glute, but nothing crazy. This is going to be followed by breath work with small, subtle movements. She's going to inhale through her nose, raising this knee up, and then exhale, press the knee forward, gaining more and more feelings in the left-sided glute. Meanwhile, the rest of the body is staying still. She shouldn't feel straining anywhere as she breathes through this position, and she does this from anywhere from 5 to 10 breaths. So again, just to highlight the subtleties involved in this drill, all we're trying to feel is the left glute, never feeling the low back, never feeling the hamstring. She's going to just gently roll the hip forward, and she'll gain a little bit of feeling in the glute, followed by raising up the knee with an inhalation through the nose, pressing the knee forward with an exhalation through the mouth. And this pelvic mechanic looks like this. So on the left side, she's taking this left side of pelvis, pushing it out into external rotation, pushing the sacrum forward, and tractioning the femoral head out. These three behaviors are all external rotation, and that's what she's gaining on the left side to push herself into the right hip. Second drill we're going to do to complement this is, again, lightly pressing the foot into the wall, but we have a little bit more demand of the left-sided hip. The higher she raises her leg, the more the glute is going to have to work to provide external rotation in this stance. Again, she's going to slowly raise up the knee and then drive the knee forward with an exhale, feeling more and more of that left glute. Make sure not to arch the low back, so we have a slight tuck of the pelvis here in this exercise, and the right knee is just hanging out about 45 degrees of flexion. But if you think of this, we are actively driving ourselves over the right hip to press ourselves into the right hip, and that's how that's going to clean up the right hip tests. So now we're back to looking at left hip function after doing our 2 drills. What I'm going to do here is start with the Ober's test, slowly bringing back that leg, assessing how well it's moving and feeling in my hand, as well as looking for low back extension. Got a little bit of a drag on the right-sided hip there, but now I'm able to drop it without her feeling discomfort. So these are 3 behaviors involved in a stance side position, meaning she has internal rotation of the femur, the hip, and the sacrum, and all 3 are required for her to stand without pain. We'll then lay on the back, and she'll report in on tightness in the front-sided hip with the leg extension, slowly bringing up that leg. Let us know.
There.
Good, so we got to about 70 degrees here. So again, each drill or activity should increase these tests every time. So now we're back to checking the right hip function. We'll see how she's doing after the 2 drills. Slowly bringing that back, looking at either rib flare, the low back extension, or the dragging of the left leg. And you can see a straight line from her right knee to her right ear. So this is a passing test. We can also drop that and it goes straight down to the table, meaning she can demonstrate all the behaviors necessary to stand up without low back pain. We'll further complement this with a drill on her feet. Looking at the straight leg. So now we're looking at the right-sided straight leg raise. We're at about 45 degrees previous. Let's see where we're at. She'll slowly raise up the leg, keeping the knee locked out, making sure it doesn't bend or she doesn't have too much orientation of the hips. And we get to about 80 degrees, so markedly improved. So now we're going to place the patient on her feet to help keep these changes locked in. We're going to do a rear foot elevated split squat with the idea of not doing it how it's typically done. For the most part, what we see is that the people will have this back foot elevated too high or too far backwards, resulting in this position of the pelvis, getting that low back extension and feeling tightness in the hips. So we want to make sure that the foot is just resting on the bench. We have a good degree of knee flexion here and a good degree of knee flexion there, and a little bit of a forward lean, resulting in a nice normal curvature of the back. And if I were to palpate the lower back, I wouldn't feel any tone outside of what's normally there. She's then going to slowly descend into the squat, tracking the knee forward over the toe the whole time with an exhale, stopping before she has orientation of the pelvis, feeling the inside of the feet, and then slowly pressing up, only feeling the left glute that she felt in the previous 2 drills on the floor. By doing this after the drills, she's opening up space in the hips with the drills and then locking it down with doing this drill on her feet to keep the results for longer. A couple of important things to take notice with this exercise. First and foremost, if you go too far down, you are going to acquire a butt wink. This is also known as posterior orientation. But what this is going to do is going to jam this bone forward into the hip to continue with this line of pain that she had with previous tests. The other thing that she needs to be cognizant of is as she goes down, to keep the normal curvature of the spine and not acquire too much anterior orientation or extension of the low back or having any of this move as it shouldn't. The last thing is we keep the weight in the left hand to help drive her into the right hip, as we did with previous drills that were shown. So this is an easy way you can check in on yourself to make sure you did the drills correctly or the exercises correctly. If you did something that was too far outside of your scope, this test will be limited, meaning you will score worse or it'll feel harder to do. So we'll check on how she did with the 2 drills and the exercise. We'll raise up the right leg with the knee actively locked out, right around that 80-degree mark that we're at. So that's encouraging. And then we'll do the left, right around that 80-degree mark as well. So with the 2 drills and the rear foot elevated split squat, we were able to improve internal rotation of the hips as well as the legs in order for her to stand correctly or in a better biomechanical way to stress the low back less. Quick and easy tips to do at home. If you have right-sided low back pain or you perform poorly on the right side with these 2 tests, these are 3 things that are quick and easy to do to help you feel better quickly.